Hello, I'm Ella Crestman, licensed esthetician and educator. In this video, we're tackling something that every skincare professional will feel at some point in their career, one of the trickiest and most uncomfortable parts of this work: how to handle a client who isn't happy with the results. So what do you do? Whether it's a facial that didn't meet their expectations, a post-treatment breakout, or a client who simply doesn't feel different. It can be really uncomfortable. Your stomach drops. You start replaying the service in your head, and suddenly, all your confidence feels like it's hanging in the balance. But here's the truth. Dissatisfaction doesn't always mean failure. Sometimes it's about expectations. Sometimes it's biology. And sometimes it's just a communication moment waiting to be handled with grace. So today, I'm walking you through exactly how to navigate this kind of situation without losing your cool, your confidence, or the client relationship. Whether you're new to the industry or have been treating skin for years, these are tools every esthetician should have in their back pocket. Let's get into it. Step 1, stay calm, stay open. The first and most critical thing to do when a client says they're unhappy with the results is to stay calm and stay open. You might feel immediate rush of anxiety or even defensiveness. That is a totally human reaction. After all, you care about your work and your clients. But your first job in this moment isn't to fix or explain, it's to hold space. Your energy sets the tone. If you get flustered, defensive, or dismissive, it can escalate the situation, even if you've done everything right technically. But if you stay steady and genuinely open to hearing them out, you instantly shift the interaction from tension to trust. Try saying something like, "Thank you so much for being honest with me. I really value your feedback. Can you tell me more about what you're noticing or how you're feeling?" This simple, grounding response accomplishes a few powerful things. It validates their experience without agreeing or disagreeing. It shows that you're listening, not reacting. It keeps the conversation open and constructive rather than combative. Practice active listening. Make eye contact. Don't interrupt. Repeat back or paraphrase what they said to show you understand. So it sounds like you were expecting your skin to feel more hydrated, but instead it feels a bit tight. Do I have that right? Sometimes just being heard de-escalates 80% of the situation. What not to do? Don't say, "That's normal," right away. It can feel dismissive. Don't rush to explain yourself before they've finished talking. Don't take it personally. It's feedback, not a character attack. This is not the moment to defend your training or break down ingredient science. This is the moment to listen with curiosity and compassion and to lead with presence over performance. Pro tip. When a client brings a concern to you, it means they still trust you enough to talk about it. If they truly don't trust you, they'd ghost you. So the fact that they're bringing this up, that's actually an opportunity to reinforce your professionalism and care. Once you've heard them fully, then and only then can you begin to guide the conversation toward clarity, education, and resolution, which we'll cover in the next step. Step 2, clarity, expectations. Once you've created space for the client to express their concern and you've actively listened without interrupting or jumping to fix it, the next step is to clarify what they've expected. Because more often than not, dissatisfaction comes from a misunderstanding, not a mistake. A client might say, "I don't see a difference. I feel dry," or even, "My skin looked better before." This doesn't necessarily mean the treatment didn't work. It may mean their expectations were different than the reality of the process or timeline. Start by gently asking, "What kind of results were you hoping to see or feel after today's treatment?" Or, "Can you tell me what you were expecting your skin to feel or look like at this point?" This allows you to gather the information you need without defensiveness. It also shows that you're engaged and interested in understanding, not just solving. Why this step matters. When you clarify expectations, you can uncover unrealistic timelines, experiencing total skin transformation in one session, for example, or a misunderstanding about the treatment, thinking a hydrating facial would eliminate acne scars. or normal side effects that weren't fully understood, like temporary dryness, redness, or purging. Emotional responses, feeling self-conscious even though the skin is clinically on track. Then you gently educate. You might say, "That makes total sense, and I really appreciate you sharing that. Based on the type of treatment we did, it's normal to feel a little dry or tight for the first couple of days. Your skin is in renewal phase. The deeper benefits will usually show up around day 3 to 5. Or, this treatment is working at a cellular level, so even though you might not see dramatic surface changes, we've activated some really important internal processes, like increasing cell turnover and calming inflammation. It's all part of the plan we discussed in your consultation." Or if there was a miscommunication, try something like, "It sounds like there may have been a misunderstanding about what this treatment is designed to do. Let's revisit your goals and talk about what's next so we can get you where you want to be." Avoid phrases like, "I told you this might happen. Even if you did," sounds defensive. That's just how it works. This can come off as dismissive. Your skin is just sensitive. This blames the client rather than guiding them. Instead, focus on clarifying and realigning using compassion authority. Use visuals if possible. If you have before and after photos, digital skin scans, or even treatment records, this can help ground the conversation in facts. Let's take a look at your intake photo. You can actually see how much redness has gone down, even if the texture changes take a bit longer. This keeps the discussion from being purely emotional and helps the client reconnect with evidence-based results. In short, ask what they were expecting, reflect what they're feeling, re-educate gently and clearly, and reconnect to the bigger picture of their skin journey. Remember, clarifying expectation isn't about proving them wrong, it's about helping them feel seen and supported while bringing them back into alignment with what's possible. Step 3, offer support, not apologies. After you've clarified the client's expectations and helped them understand what's normal or expected post-treatment, your next step is to offer supportive next steps without apologizing for doing your job correctly. Here's the distinction. You're not saying, "I'm sorry, I did something wrong." You're saying, "I see you, and I'm here to help guide you through the next step." You're acknowledging the experiences without taking unnecessary blame, and you're stepping into your role as a calm, confident professional who knows how to manage outcomes, expected or not. For example, "It sounds like your skin is more reactive than we anticipated. Let's pivot your routine slightly. Keep it super simple and stick with the post-care plan we discussed. I'll check in with you in 48 hours and see how things are settling." Or you could try, "We're still in the early phases of your treatment plan, and I know it's hard to not see instant results. What we can do is focus on strengthening your barrier over the next few weeks so your next treatment performs even better." Here are a few pro-supportive responses. "Let's monitor this over the next few days and I'll check in with you mid-next week." This is a normal response, but if you're not feeling comfortable, I'm happy to offer a mini follow-up or calming treatment at no charge. Let's adjust your at-home routine so your skin stays supported while it's healing. You're demonstrating care and responsiveness, not guilt or panic. Why this approach works. Clients don't want someone who just apologizes. They want someone who takes ownership, reassures them, and offers a plan.